to thank you all for joining us. We are here to talk about the COVID-19 vaccines in the city of Columbus with our very own Dr. Mysheika Roberts and Chair of our Health and Human Services Committee, Councilmember Priscilla Tyson. Tonight, we're going to explore the myths surrounding the vaccine and dive into how to maintain our emotional health and well-being as we continue to live throughout this pandemic. Then we will take your questions and hopefully help ease some concerns that folks may have. I'm really excited about the vaccine being available. I feel like finally hope is right at our doorstep. A few weeks ago, I was able to take my 86-year-old grandmother to get vaccinated. It was an easy process. We're really excited that her booster shot is scheduled for 11 a.m. on Saturday. And she is thrilled about that. And so just want to thank everyone that is administering that aid right now. As a new component of us starting our hearings and certainly our council meetings, I used to talk about the COVID deaths that we were seeing every day and every week at the beginning of council meetings. And that certainly is important as we remember those who are struggling, who are losing their lives, and as a reminder that this virus is still with us. But as we have transitioned into this next phase is about keeping folks alive now. We finally have the thing that can keep folks alive. So I thought it was really important that we also transition to talking about how many folks that we are taking that next step and keeping alive. And so to date, we have in our jurisdiction vaccinated 31,499 people. And just yesterday, we vaccinated 1,608 folks. And so we're really excited about those numbers. We obviously need to get those numbers higher. We have I won't speak to capacity. Maybe I'll ask that question of Dr. Roberts later. But we're really excited about those numbers. We want to see even more opportunity and access, of course, but wanted to celebrate for those 31,499 of our neighbors who are one step closer to full being vaccinated against this. So I'm excited that Hope and Safety is available for our residents. I'm also just as excited for the vaccine to become available for the general public. The COVID vaccine will get us closer to a safer Columbus where we can slowly transition back to life before COVID. We have to keep doing what we've been doing the past year and continuing to wash our hands, social distance, and only leave the house when necessary. We are so close to beating this virus, and that's why we're here tonight. Talk about the vaccine and what it means for our community. With that, I am going to turn it over to my colleague, my friend, and chair of the Health Committee on Council, Councilmember Tyson, to give opening remarks.
Thank you, President Harden. And as chair of the Health and Human Services Committee, I am pleased that we're continuing the dialogue about COVID and the COVID-19 vaccine. I am looking forward to hearing from Dr. Roberts and the experts that will provide background information about the science and clarify the facts versus the myths regarding the COVID-19 vaccine. I also appreciate that we have an opportunity to respond to questions that have been submitted by various members from our community. I believe as people are making decisions about their health and getting the vaccine, it is important to listen and understand the facts. While I recognize that getting the vaccine may be a complex question for some, I believe that it is important to take a few moments to reflect on the bigger picture. We know that COVID-19 does not discriminate. We know that men, women, young and old have contracted COVID-19. And some of the individuals in our community that have contracted this virus, some of them have recovered and others are no longer with us. So if it is contracted, there is a good chance it could be passed on though to a loved one. So for those who do not want to take the vaccine for themselves, it is important to consider taking it for the sake of others who they may encounter, particularly the elderly and people with compromised immune systems who might not be able to fight off the virus. I want to stress I'm not telling people what to do, but hopefully I can inspire people to get the facts from trusted sources as they consider making decisions about getting the vaccine. And on a personal note, I have taken the vaccine because I trust the science. More than any other time in our history, there is an enhanced sense of awareness about the struggles associated with health equity. And now we have African American doctors like Dr. Corbett, who are at the forefront of the COVID-19 fight and turning the tide on this global pandemic. I want to thank everyone for being here today, and I look forward to our discussion. I would like to welcome Columbus Public Health Policy Director Edward Johnson, and he will now give us a presentation on the status of COVID-19 in Columbus.
Thank you, Chair Tyson, and thank you to President Hardin for having us here today. If you'll permit me a small indulgence, I really just want to say thank you so very much for the leadership that you guys have given and the opportunity to work with you throughout this entire pandemic. I think it's been vitally important to have leaders who hear what we have to say, judge it carefully and wisely, and then act on it to the best of their ability. And I think that that's something that we've seen from our city council throughout this pandemic. But to your point and to your question, Council Member Tyson, Chair Tyson, excuse me, here in Columbus and throughout Franklin County, but Columbus specifically, we have 77,646 total confirmed and probable cases. Unfortunately, we've seen 849 deaths due to COVID-19 or with COVID-19, with just under half of those, 402, occurring in long-term care facilities. And so that's part of why we've also seen this prioritization of congregate care settings in that phase, that priority 1A category for vaccination. To that point, we've also seen sex and gender breakdowns occur pretty much along citywide demographics. Our hospitalizations are at 4%. And so we know that that's also something to be aware of as well, including being mindful of the burden that our healthcare workers have borne as well. In terms of race and ethnicity data, which I know is of particular interest, we always like to look at the rate per 100,000 to really understand and know which groups are bearing the burden of this disease most closely. And so it's always that third bracketed number on our epidemiology reports. And so you see there that our non-Hispanic white community here in Columbus, they may have the most total cases, and we see there under the bracketed number that they are bearing a very high burden. But when we move to non-Hispanic Black or even to our Hispanic community, we see that they're really bearing the burden when it comes to cases. And it's even more pronounced when we move to hospitalizations, as we see the rates almost doubled that of non-Hispanic whites for hospitalization. When we move down to the fatalities, we know that the long-term care facility deaths really do play into that significantly. And so that's something that we also want to be mindful of. Oh, excuse me. In terms of the age breakdown, we also want to be mindful that, yes, it is our older folks in our community, that 60-plus age cohort, where we do see a lot of the deaths, but not necessarily a lot of the cases. And so that's something that we definitely want to be mindful of as well. In terms of trends, we feel really optimistic as of late, and we feel really encouraged that we are seeing week-on-week double-digit percentage decreases in the number of cases that are being reported to Columbus Public Health. We've seen this really positive momentum since about mid-January, and we hope to see it continue throughout February and hopefully into March. I will say that March is a month that we are watching very closely. If you see the news and you see the discussions about the international variants, that's a month where we want to see what that impact will be locally. And so we are watching it incredibly closely. But just to buttress and support this decrease in cases that we've seen, over just about that same time period, we've also seen a decrease in the number of hospitalizations with COVID-19 as well. And so we see that our hospitals are seeing a little bit of relief. We see that the number of cases that are coming in are providing us with a bit of relief. And then we pair that with vaccines being available in our community, and we feel very encouraged. And so with that, Chair Tyson, I don't know if you have any questions on the numbers, but we do feel encouraged, and we're watching for March to see how things will continue to go.
Chair, I think we're still muted. Sorry.
Sorry. Thank you, Mr. Johnson. I really do appreciate your presentation and giving us really an update as to where we are in the city of Columbus in regards to individuals who have either contracted COVID. Just providing us an overview of COVID-19, how it has affected our community. And certainly just to emphasize that, as you mentioned, it certainly is impacting our Black and Brown residents in our community at a significant rate. So I thank you for your presentation, and I don't have any questions. I would now like to turn the floor over to Council President Harden.
Thank you, Madam Chair, and thank you. I think we heard some good news in that presentation around the drop in cases, and I know I also heard some caution as well that we still have. We're still in this, but I think we should take our celebrations, like, the good news too when we can.
Yes.
Yeah, Councilmember Tyson, and also want to recognize our colleague Councilmember Remy, who has joined us for this town hall conversation. Thank you, Councilmember, and feel free to jump in when you have questions as well as we move along in the presentation. I think I have a quick update. So if you need time to take off of work to care for your child recovering from COVID, but you can't afford it, the Right to Recover program that was funded by City Council and championed by President Pro Tem Elizabeth Brown provides up to $1,200 to help recover the wages you lost while caring for a child recovering from COVID-19. In partnership with the Columbus Urban League, the program is designed to help support families working to stop the spread of COVID-19. For more information about this program, call 614-484-9111. There are restrictions that apply, but the number again is 614-484-9111. With that, I think I turn it back over to Chair Tyson.
Thank you, President Harden. And again, it's so wonderful to have these resources to help our residents as we are moving through COVID. I would like to welcome Dr. Sophia Tolliver. Dr. Tolliver is a clinical assistant professor of family medicine and vice chair for wellness from OSU Wexner Medical Center Outpatient Care East. I'd like to give Dr. Tolliver an opportunity to speak about her experiences with the vaccine process and working with patients. Dr. Tolliver, the floor is yours.
Member Tyson, also to Dr. Williams for having me here at the town hall. If you see me looking over this way and that way and cocking my ear a little bit, my 8-month-old daughter is in her crib, and I'm just trying to keep an eye on her. Sign of the time, a sign of the pandemic time, certainly. So why am I here? I am really here as a community physician and an African-American community physician to really say Black people have every right to be hesitant about taking any new medical therapies, right? When it comes to America, we have this very extensive historical legacy of not only racism, but medical racism, mistreatment, manipulation. And so in terms of where we are right now with the novel COVID-19 vaccination, Black people are still coming to a reconciliation with this. And so we need to normalize people taking the time to say, hey, what is this new thing that's coming out? And is it right for me and my family? We need to normalize people being able to ask questions, to understand what's going on. And it's okay to be hesitant, I think, because in that hesitation is a really great opportunity to ask questions and seek out trusted individuals such as myself or my colleagues to really ask those questions that might make the difference for our patients in terms of obtaining the vaccination or not. Let's normalize wanting to gather more information and encourage people to go seek out their physicians, their healthcare providers to ask those questions. I always let my patients know in our visits here at my kitchen table clinic, what questions do you have? How can I be a resource for you? Let's dispel some information. There's a lot of social media disinformation that's rampant right now, a lot of anecdotal information that's not set or placed in the data, in the science, and we really want to move away from that. We really want patients to make decisions based on facts and not fear. So I welcome those questions. In terms of my patient panel, my patients have run the gamut. And I see people from all walks of life. And I am definitely passionate about underserved and minority communities, health messaging, community health messaging. So, I get everyone from I'm very hesitant about it, I don't trust it. That's a common comment that I get. I get those who are excited and anxious. They say, I don't trust it. I trust what you say. I don't trust it. I trust what you say. So, let's go ahead and do it. Order it for me. And the subtext of that being, I hope you know what you're talking about, right? And we do know what we're talking about, especially at Ohio State, where they train you very well. So I'm happy to be an Ohio State physician. We have the ambivalent who, really could care less. They don't have any questions for you, and that's okay, because we're going to mention it to you in our visits, right? We're going to hopefully plant that seed. So one day, maybe you'll say, let me go back to Dr. Tolliver and ask a few more questions. And then we also have those that are very frustrated. Logistically, the rollout of the vaccination process hasn't been kind to everyone. And we have patients who are messaging us really sort of in that fear. I had one of my 70-year-old African-American male patients who has a pretty extensive medical history message me the other day, and his words were stark. He said, "Doc, I am a Black man in America. I do not want to die. I do not want to die." And so it was very disheartening, but we were able to kind of talk about things and get him on the right track, get him the right information so that he could call and schedule. But we really want to stop this circle of misinformation. Again, decisions based on fear, not facts, because it becomes a vicious cycle of sorts. We know that COVID-19 disproportionately affects our Black and Brown communities, absolutely in part due to racism. Our vulnerable communities are made vulnerable by racism. When we talk about social determinants of health, where you live, where you work, where you play, where you get educated, where you eat or where you don't eat, all of these things play into your health. And so we see significant rates of diabetes and hypertension and heart failure, chronic diseases that make us more susceptible to more severe disease. And so we want to stop that vicious cycle, because if we don't get the vaccination, we're just going to be in this cycle of more people dying, not getting the vaccine, more people dying. So in a nutshell, again, less resources in the community translate to a less ability to access care or treat disease and ultimately fight COVID-19. So we want to honor our lives. We want to really know that Black lives do matter in this sense, in every sense, and encourage people to ask those hard questions. The message is really simple. Let's normalize the process of vaccination, right? Vaccines are safe and effective. COVID-19 vaccine, safe and effective. We know the data, we know the studies, and we expect that, with these vaccinations, there could be some side effects, right? Because that's the purpose of vaccination, to trigger your body's immune system so that when you encounter the real virus, your body says, hey, I've seen this before, let's fight the disease so that you don't have severe symptoms that will land you in somebody's ED and eventually in somebody's inpatient ward, and hopefully not in the ICU, and absolutely not on something more dire, right? So my personal experience with the vaccination, I am fully vaccinated. It was funny, I was pregnant in a pandemic, and then breastfeeding in a pandemic. And so there was, a lot of concern and sort of unknown path to travel in terms of that. Do I get the vaccine? Do I not? Absolutely, I got the vaccine. The first vaccine that I got, my side effects were pretty moderate. I had chills. I didn't have any fevers. I had very severe body aches. I was very tired. But thankfully, all of that went away in about 24 to 36 hours. Come the second vaccination, it was probably twice as bad. But I knew what to expect. And so I was prepared for those symptoms that came on pretty harsh. But again, probably in 24 hours, those symptoms were gone and I was right back to normal. So I got vaccinated because I trust the data. I trust the science as an African-American physician. I know that my voice as an African-American physician matters. And, you know, I think about my patients. My oldest patient is 99 years old, and she recently got the vaccination. And I think about, you know, she was here during the 1918 influenza pandemic and everything that she's seen and how we are here again, how she's experiencing a pandemic again. But now we have better treatments, we have better technology, medical technology. And so we owe it to ourselves to seek out all of the information, all of the correct information, so our communities can make good decisions for themselves and for their families.
Well, Dr. Tolliver, first of all, thank you for coming and sharing your story, and also sharing the information from some of your clients, and giving our audience an opportunity to be able to hear that from a 99-year-old person, a 70-some-year-old individual, that they have all have asked questions. You've been able to give them information, and I'm happy to hear that the person that's 99 years old took the vaccine. I think some of the messaging that from what you just shared with us is we have to normalize this vaccine. And I'm hopeful that even during today's, the rest of today's hearing, as we hear from Dr. Roberts, and that we will, again, the importance of fact versus myths, and to talk through that, and that make sure that we are listening to trusted professionals. I also appreciate that Black physicians are certainly speaking out and sharing the importance of taking this vaccine, as well as sharing the symptoms that can occur once you've taken the vaccine. So I just really appreciate you coming in and sharing, and I'm hopeful that many of I think most of the questions I was going to ask you, any stories you want to share, I think you've shared some already. So I guess let me ask this last question. When people are scheduling for the vaccine at Ohio State, what should they expect to happen?
So for our patients, you know, Ohio State had a rollout of the vaccination scheduling based off of age. And we have a couple different mechanisms at the hospital. My chart is a huge way that we are distributing information about where to call, when you're eligible, and what to expect. And so we've sent messaging out via that mechanism. But if for instance, somebody is not checking it or they don't have access to my chart, we are including a mechanism where we are calling patients as well, who are eligible to get vaccinated, to get scheduled. So, you know, as with anything, all the best laid plans, you know, sometimes don't always work out, but, you know, there might be some delays. And so we're asking patients to be patient, but we are working through the lists and the spreadsheets. And our hope is that we can get everyone who wants a vaccine scheduled to be vaccinated.
Thank you. Thank you. I don't have any other questions. I don't know if President Harden or if Councilman Remy have any questions that they would like to ask you. But again, I love that you're saying we have to normalize it and make sure you're asking, you know, you're having, you know, questions, if you have questions, you're going to discuss those with your physician, and hopeful, and make sure that they answer your questions. Don't be afraid to ask questions about the vaccine to a trusted professional. But
Absolutely.
President Harden?
Thank you, Madam Chair. I have one quick question for Dr. Tolliver. Thank you so much for being with us tonight and doing that double duty of with baby duty and answering our questions. You spoke about something that I've heard a couple of times now from a few of my friends who are physicians or folks who have taken the vaccine, which was the side effects. Would you talk? How do you talk to your patients about fear of the side effects even? And I'm going to ask that question later on in the presentation around with Dr. Roberts. Are we tracking how many people have moderate side effects? Just for our own knowledge, but for you, Dr. Tolliver, how do you talk about these side effects for folks who are even scared of? Well, some folks are even scared of needles right away, and I think you could talk about it doesn't hurt that bad. And Councilmember Tyson, you could tell us it doesn't hurt, but then the side effects.
Yeah, so really, I have to give a good old shout out to the influenza virus, right? Before COVID-19, the flu season was our big sort of season, and our messaging was get the flu shot, and inevitably season after season, and I'm a relatively new, young physician. Our patients come in, and one of the major sort of statements is, I do not want to get the flu shot because it gives me the flu. I felt like I just had the flu. And so we know that through the science, through the data, that there's no way that you can get the flu from the flu shot, because especially if it's not a live flu shot, you're getting parts and pieces, for lack of better words. You're getting parts and pieces of the virus so that your body can start to recognize those parts and pieces, so that when it does get to, again, that full virus, your body can fight it off. And the main message that I want to get across to my patients is that the body has to be triggered in order to get that information to the immune system to fight that disease. And so that triggering could be fevers, it could be chills, it could be stomach aches, it could be body aches, it could be fatigue. We need to reasonably expect some level of side effects from vaccines, because that's what it's triggering our body to do, to have that immune response. And that conversation doesn't always work the first time or the second time. I think I've worn some of my patients down over the years in a very thoughtful way. We never want to force anybody to get the vaccines. But I think my messaging for COVID-19 actually came sort of out of the flu season, in that, again, the immune system needs to be triggered. Let's talk about your fears in terms of needles. I have to say, with my 2 vaccinations, and I am really, I'm a physician who's afraid of needles. Over the years, I've had to kind of quell that, but I do not like needles. And so anytime they bring that needle to me and they're about to inject me, okay, I have to take a breath or I might pass out. But the vaccination, both times around, I hardly even felt it, and I don't know if that's because of technique from the person who was doing it, but we don't want to make a bigger deal over something that might block us from our blessing, that might block us from being safe, that might block us from disease. If that's the momentary pinch that we need to have longevity, to make sure that we are healthy, I say, come on, certain things in your life are probably more painful for you. Maybe getting up in the morning is painful, or having to shave your beard in the morning might be more painful. A momentary pinch so that you can trigger your immune system to block and fight a disease that is literally killing people. I want you to think about that. You don't have to make any decisions right now, but think about it. Come up with some questions. Let me know. Let's talk about it. And I've had some people come back and say, you know what, schedule me. Let's get you in for a medical assistant only vaccination appointment. You don't even have to come in and see me. And this is for the flu shot when we were doing flu shots. We're not doing COVID vaccinations in our clinic right now. But, it's all about planting that seed, really, and trying to meet people where they are. And again, being thoughtful about where people are, being thoughtful about their hesitancy, and allowing them to be so. Because if you can plant that seed and it grows and they actually get the vaccination, they can go back and tell their friends, they can go back and tell their family. You've created an advocate. You've created a community advocate just in your 20-minute office appointment, who is going to go back and share with their community their experience. And hopefully they had a great healthcare provider that taught them something, and that inspired them to do something greater beyond themselves.
All right. Well, thank you, Dr. Tolliver. And I would agree with you. When I had I was looking forward to getting it. So I was excited to go. And certainly it felt just like a flu shot. And it was fine. It was sore the next day, like a flu shot, so we sore the next day. And other than that, had a few little body aches, but other than that, it was great. And again, as you just stated, the importance of that momentary little few body aches compared to what's the worst case scenario of getting this disease. So thank you for coming and sharing information with not only us, but the residents of Columbus. And I just based upon your enthusiasm and your knowledge, I'm sure that you people will certainly think about taking the vaccine based upon your presentation. So thank you so very much.
Thank you guys for having me.
Thank you. Council President Harden, I'm going to turn the floor back to you. I think you also have another public service announcement.
Yes, ma'am. So no matter where you hear dangerous myths about COVID-19 vaccines, the myths can cause doubt, leaving you looking for answers. So town halls like this and Ohio's upcoming COVID-19 vaccine event will give you the answers that you need. So get trustworthy information. That means real information about COVID-19 vaccines from medical experts, community leaders, and most importantly, public officials, not public officials, public health professionals. For more information, visit coronavirus.ohio.gov/town hall. It is so critically important that we're getting the right information to our community. And so I would just encourage you, please, please, please. And for the young folks, this happened so much in my family over the last month. Don't share memes talking about the virus that do not come from a trusted source, from the CDC, from the public health department, or from your doctor. It's not helpful, and it puts out information that may not be correct. So if you have questions or if you want to share information, you can visit coronavirus.ohio.gov/town hall. Am I up next? Looks like I am. I now like to turn things over to Dr. Roberts, who's going to give us a presentation about the vaccine. Dr. Roberts, the floor is yours.
Well, good evening, everyone, and thanks for having me, and thanks for doing this. I really want to echo the sentiments of my colleagues, Edward Johnson, about just your leadership through this. Talking to my peers across the country, I know not everyone has the support of their elected officials in their community, and so I'm very grateful of your leadership, Chair Tyson, as well as your leadership, Council President Harden, as well as you, Council Member Remy. I appreciate all of you. I'm fortunate to live in the city of Columbus. I'm going to ask Edward to assist me with my slides. Hopefully he's still there. I just need him to upload those slides for us, if he could, please. Let's see. There we go. Thank you. So I'll take the next slide. What's important is we are still in the midst of the pandemic. And as you heard from Edward, our numbers are going in the right direction at this point in time, which is good. And it's mostly a testament to what we've been doing here in our community to reduce the spread of this virus. We have several tools in the toolbox, and you see them here. Wearing a mask. We've been wearing a mask since, if not June, maybe even before June, we were wearing a mask, and they started to be mandated in July. We've been telling people during respiratory season, but especially during this pandemic, to wash your hands frequently. And when you don't have access to soap and water, use hand sanitizer. We've been talking about spacing, 6 feet of spacing, and avoiding those crowds. And at the end of 2020, we found out we had 2 very effective vaccines that are on the market. And we're starting to get some in our community vaccinated, as you've heard already from Dr. Tolliver. We still got a lot more work to do in terms of getting our community vaccinated. But these tools that you see here is what we all need to do to get us to the other side of this pandemic and get us to some sense of normal life that we experienced prior to March of 2020. I'll take the next slide. So you heard a little bit about the vaccine already, but I want to expand on that and tell you what the benefits are to getting this vaccine. So this vaccine will help prevent the individual who got vaccinated from getting sick with COVID. If you are not sick with COVID, you're going to drastically reduce the chances of spreading that illness or that virus to someone else that's close to you. someone in your household, one of your family members, friends, or loved ones that you might be in close contact with. Now, this vaccine does not necessarily prevent you from getting COVID-19. What it does do is prevent you from getting sick with COVID-19. So, why I say that is because the vaccinated person is the protected person. You're likely going to shed less virus, but we still need to do a little more research to find out if you get exposed to COVID-19 and you don't build up the symptoms of COVID-19. Could you potentially be shedding the virus, even though you're asymptomatic, to your loved ones who are not vaccinated or are not protected? That's why it's so crucial that at this point in time, even once you get vaccinated, you still follow those public health recommendations that you saw on the previous slide. I do want to reiterate that this vaccine is safe and it's an effective way to build up immunity and protection for yourself. It is one of the most important tools that we have now. And again, I just want to reemphasize, if we can get a vast percentage of our population vaccinated, it will get us to return to some sense of normalcy sooner rather than later. And I'll take the next slide. So let's talk about some of the myths that I've heard about this vaccine and what I want to share with you to dispel those myths. So the vaccine itself is not a live vaccine. So it does not give you COVID-19. We do have some vaccines on the market that do that, but COVID-19 vaccine is not one of them. I can give you an example. The chickenpox vaccine is one of them. So, that's just something to put in perspective. We have live vaccine, but the COVID-19 vaccine is not one of them. So it will not give you COVID-19. It also will not cause you to test positive for a COVID-19 test. It is arming your body with the defenses so that you can respond to the virus if it's introduced into your body. But it does not give you the virus, so it will not make you test positive for COVID-19. These vaccines are made out of mRNA, and M stands for messenger RNA, but it does not change your DNA. Your DNA is there. No one's going to change it. It's the foundation of who you are. The vaccine does not contain any fetal parts or any human parts, and it does not contain any pork or animal products. That is a concern for some people for religious reasons and other reasons. They're concerned about this. There are all concerns because there are some vaccines where the plunger, for the picture that you see now, that little purple part is made of rubber. Sometimes that contains porcine product, but none of this vaccine vial or the medication inside contains pork or animal products. And it does not have any tracking devices. Some people have heard that there are nanoproteins in this virus. Nano is very small in the medical field, and they're very tiny proteins that are used to help get inside some of your cells, but they're not tracking devices. If the government wanted to track any of us, they would use our smartphones because that's the easiest and the most effective way to track any of us at any point in time. So I wanted to dispel some of those myths. I'll take the next slide. Some people are very concerned about how quickly this vaccine got to the market, and is it safe, and is it appropriate for us to take it because they feel it was rushed? Well, so I'm not going to lie, this vaccine did go through an expedited process, but no safety measures were slighted or missed because of that. Scientists have been studying this virus for many years. So just to put it in perspective, the COVID-19 virus is a part of the same family that caused MERS and SARS. You might have heard about those viruses before because we've seen them here in the United States as well as across the country. But we saw them in very small quantities. Not very many people were infected. They weren't as easily transmissible as COVID-19. So as a result of that, scientists around the world have really been studying the MERS virus, again, which is a cousin of COVID-19, since 2004. And so we had a lot of information, a lot of research that had been done with this. So when COVID-19 was first identified in Wuhan, China, in December of 2019, and we quickly learned that it was a cousin to MERS and SARS, many scientists from across the world started studying it. And when we realized how quickly and how easily the COVID-19 virus was transmitted, scientists knew that the only way to stop the spread of this virus effectively across the world was to have a vaccine. So they immediately started studying how they could create a vaccine for this virus with the foundation they had had since 2004. So in January 2020, they actually got the fingerprint of this virus, of COVID-19. They took all the knowledge they had gained over the last 17 years, as well as the fingerprint. And then they also had a foundation of working with mRNA vaccines. And so they merged all that information together and quickly started making a vaccine that could be effective for everyone in our in the world, really. So that was the foundation. They quickly gathered that information and started phase 1. As you can see here, phase 1 is usually just a small population, anywhere between 20 to 100 people. What they also did is when they started phase 1, they did phase 2 and phase 3 almost at the same time, which is unusual. Usually we do phase 1. Once we've completed that, we go to phase 2 and so on. But because we knew that getting a safe and effective vaccine was the only way to get us out of this pandemic, they did the phases concurrently. That's why it got to the market as quickly as it did. They did it concurrently because we were in the middle of a pandemic and they knew we needed something to stop the spread of this virus in our community as quickly as possible. All the phases were completed. They were just done concurrently. Then it went to the FDA for emergency use authorization. And I will say it got emergency use authorization, not full approval, because the fact we're in the middle of a pandemic. It'll take a few more months and more time and more data has to be collected before it actually gets the full FDA approval. But at this point in time, it has emergency use authorization and was vetted by the advisory committee, which is an independent advisory committee by the FDA. So I'll go ahead and take the next slide. I do want to reiterate again that these vaccines are safe and effective. They were held to the same safety standards of all other vaccines. The only thing that was different was the timetable and the fact that the different phases were held concurrently instead of one after another. I do want to reassure you that the United States has an excellent track record of making safety its #1 priority when we approve drugs and vaccines. That's why you might have seen some other countries get a vaccine before we did here in the United States, especially for COVID-19, because their process is just different than ours and it's not as thorough. They don't always have independent advisors. So I do want to reassure you that the vaccine is safe. Now, earlier I heard Council President Hardin talk about side effects and do we track side effects? So I want to really differentiate side effects of the vaccine versus adverse events of the vaccine. So side effects are those things we anticipate happening, like a sore arm, like fever, like some body aches, maybe a headache. We anticipate, we know that's going to happen. That's what we saw in the clinical trials. That's what most individuals had after getting particularly their second dose of these 2 vaccines. Adverse events are the things that we didn't see a lot of people experience. That could be a seizure after the vaccine. That could be passing out after the vaccine, getting hives all over your body. Those are adverse side effects or adverse events. So we do track the adverse events. And as a vaccine provider, we are obligated to report those adverse events to the CDC through a program called VAERS, which is Vaccine Adverse Event Reporting System. But we don't report the side effects. That being said, the CDC does have an app and a website that they have put up for people who have been vaccinated called vSafe. Individuals who are vaccinated can go to that website, can put in their information, and they can track their side effects, their experiences after the vaccine with the CDC. And the CDC is tracking that from all recipients across the United States. That's completely voluntary. It's not something the vaccine provider does. It's something the patient, the individual will do to track. But again, they're tracking the side effects. Vaccine providers do not track side effects. We do track adverse events. I'll take the next slide. I want to talk about the 2 vaccine products that have received emergency use authorization, and then talk a little bit about the vaccine that we're anticipating getting emergency use authorization at the end of this month. So we have 2 vaccines on the market right now. They are both made from this relatively new platform called mRNA vaccine. The Pfizer vaccine has 2 doses. Each dose is 21 days apart. The first dose is kind of like that introductory dose. It's the primer dose. And that second dose is the booster. It really just boosts your immune system and gives you that full protection. The Pfizer vaccine is 95% effective, and it has received emergency use authorization for those who are 16 years of age and older. The Moderna vaccine also is 2 doses, but each dose should be 28 days apart at minimum. I want to say at minimum because you can go more than 28 days, you can go more than 21 days. And the CDC has said you can even go as far as 90 days between each dose. Obviously, that's not something anyone's practicing now, but if for some reason someone was in that situation, the CDC says it's better to give the dose late than to give it early. So 28 days for the Moderna vaccine. The Moderna vaccine is 94% effective, and it has been approved for individuals 18 years of age and older. Now, you notice that children are not approved to get these 2 vaccines that are on the market right now. Children were not involved in the clinical trials that already existed, that occurred already. They used adults 18 and over and a few people who were 16 or 17. So we don't have any data to show us whether vaccines are safe and effective for children. We are working on that now. We as scientists are working on that now. There are clinical trials going on right now to look at the effectiveness of this vaccine in the pediatric population. We're optimistic that we're going to have more information about these 2 vaccines and maybe others that will be given emergency use authorization for our pediatric population. And we're hoping by the summer we might have that. Now, Johnson & Johnson is another vaccine, again, that is scheduled to go in front of the FDA Advisory Committee next week to get emergency use authorization. The difference between the Johnson & Johnson and the other 2 vaccines is the Johnson & Johnson is a 1 injection vaccine. You don't need 2 doses, you just need 1. The Johnson & Johnson vaccine also appears to be a little less effective than the other 2. I've heard everything from 70 to 80% effective. So it's less than what I just mentioned for the other 2 vaccines. But I also want to preface and say, when the Johnson & Johnson clinical trial was occurring, because it just wrapped up its clinical trial, there was a likelihood that there were more of these variants, these virulent variants that you've heard about, the UK and the South African variant. It's likely that those were circulating in the community at the time the clinical trial was going on. And that is probably why their effectiveness is less than the other 2. The other 2 clinical trials were happening when we didn't see the amount of the virulent viruses or the variant viruses that we see currently. So that could explain why it's less effective or appears to be less effective than the other 2 vaccines. I also just want to say, when we look at the clinical trials collectively between Pfizer and Moderna, they had 70,000 volunteers involved in the clinical trials. That's a lot. It's very hard to get people to get involved with clinical trials. They had an outpouring of support and interest. And of those, I can also tell you that 10% of their volunteers in the clinical trials were African American, and a large percentage of their volunteers were also minority. So I'll go ahead and take the next slide. So when the FDA gave emergency use authorization to these 2 products, they also had the CDC weigh in and give some recommendations of how the country should give out the vaccine, who should be prioritized. But that was a recommendation from the CDC. Ultimately, it was left up to the states of how they wanted to distribute the vaccine. So here in Ohio, the state came up with a phased approach. They called it phase 1, phase 2, phase 3, and 4. And you can see from this slide, when we have limited supply, it's phase 1. And as we get vaccine supply that's widely available, we'll move on to phase 3 and 4. Right now, we're in phase 1B. 1A was the first phase we started with. That was primarily healthcare workers, EMS workers, and those working and living in congregate settings like our long-term care facilities, where we have an older population and where we in Ohio have seen the majority of our deaths. Phase 1B, I'll tell you about on my next slide. But I just want to let you know it's a phased approach. As any vaccine provider in Ohio, we have to follow the state's guidance of the phased approach. Otherwise, we could be in jeopardy of losing our vaccine supply. So on the next slide, just, kind of goes into a little more detail of what our schedule is and where we are now. We are in phase 1B, which is focused on those who are 65 and older, and those also who have qualifying medical conditions. Those qualifying medical conditions are not what you typically have heard and seen as chronic diseases. They are some diseases like sickle cell anemia, epilepsy, those with severe lung disease who have required hospitalization in the last year, those who have type 1 diabetes who have required hospitalization in the last year, those with epilepsy, those with some metabolic disorders. They're very specific medical conditions that are the qualifying medical conditions. And then obviously those who are 65 and older are also in 1B. If you want to receive your vaccine by Columbus Public Health and you live in the city of Columbus or Worthington, you can go to columbus.gov/coronavirus. You can also call us at 645-1519 and register. To see a full list of all vaccine providers in the state, but specifically you can narrow it down to Franklin County, you can go to the state's website at vaccinecoronavirus.ohio.gov. We have about 24 vaccine providers currently in Franklin County. So our 3 adult hospital systems are currently vaccine providers. The 2 health departments, Columbus Public Health and Franklin County Public Health, a host of stores like Giant Eagle and Kroger. We have a few CVS's and Walgreens, and all of our federally qualified health centers received vaccine this week as well, following those current tiers in 1B. I'll go ahead and take the next slide. Council President Hardin, you started off mentioning how many people we vaccinated at Columbus Public Health at our location at the fairgrounds. You're right, 31,497. That was as of close of business yesterday. So we did some more today. But I want to just emphasize, this is what Columbus Public Health has done. As I stated earlier, we've got multiple vaccine providers in Franklin County and in the city of Columbus who have also been vaccinating individuals. So I would think and the data is available at the state health department's website, but I think here in Franklin County, we've probably come very close to vaccinating about 65 to 75,000 individuals. I could be wrong on that. Keep in mind that the group 1A were a lot of healthcare workers and long-term care, congregate living workers. So they might have been vaccinated by a Franklin County vaccinator, but they might live elsewhere. And so the number we vaccinated might not actually add up to the number who actually live in our community. But these 31,497 should all be living for the most part in our community. Now, keep in mind, we vaccinated the Columbus City School staff. Not all of those staff live in the city of Columbus as well. So I want to spend a little bit of time to talk about disparities, because I think you can't talk about this pandemic and talk about health without talking about health disparities that exist here in Columbus, but really what the pandemic has unveiled. And for some people, it's unveiled. For many of us who've been in public health for years, what we've experienced in terms of the disparities during this pandemic is not surprising, unfortunately, to us. So you heard Edward say earlier about the disparities we've experienced with the numbers and how African Americans and Latinos have been disproportionately impacted by COVID-19 with hospitalizations and sometimes even death. Unfortunately, we've seen that with vaccine uptake as well. Only 4% of those that we vaccinated at Columbus Public Health have been African Americans. Now, there's a few different reasons for that. And so some of them, and you heard Dr. Tolliver mention this before, the mistrust, the misinformation, the access, the historical mistreatment. I mean, we cannot deny the Tuskegee study. We cannot deny the Henrietta Lacks. We have to acknowledge it. We have to recognize it. We have to remind our community, as a result of those circumstances, the medical community has made some significant changes to prevent those things from happening again. We have informed consent that we never had many years ago, where you have to sign something that really states you understand what you're doing, you understand the risk that is being taken. When the Tuskegee study happened, there was no such thing as informed consent. They didn't consent to anything, really, and they didn't know exactly what they were getting into, obviously. But there's some other reasons why we see this disparity in the vaccine uptake, and I've made this as clear as I could to the state leaders as well. But if you look at the groups that we've opened up the vaccine to thus far, when you look at healthcare providers, we all know that Blacks are underrepresented in the healthcare field. So they're going to be a smaller pool of African Americans in that 1A group than there would be in another sector that we might choose to vaccinate. We also know that African Americans have a lower life expectancy. And there's some recent data that just showed that as a result of the pandemic, the nation's life expectancy has decreased, and African Americans has decreased even more than the average for the nation. So when you start vaccinating individuals 65 and up, there are less African Americans 65 and up because our life expectancy is shorter. So there's going to be some disparity until we start to open up the vaccine to more in our community, as well as address some of the issues that I listed here about the mistrust and the misinformation. And we've got to improve the access as well to the vaccine. So Columbus Public Health is proud to say that we have created a vaccine equity plan, and we are working through it, working on it. It's something that keeps me up at night, literally. It's really a 3-part plan where we're going to increase access, we're going to remove the barriers, and we're going to improve communication. So in increasing access, we're devoting a minimum of 20% of the vaccine we get every week to the vulnerable population. We're making sure we collect information on race. It should be collected by everyone, but not everyone really takes the time to make sure that the boxes are checked. And I've really gotten on my staff because there's an option on ours about unknown. I said, take out unknown, make it say other, and make people have to write in what their race is. I want to know who we're vaccinating. We just started today, and I'm really happy and proud of my team, a weekly opportunity vaccine clinic for individuals who live in our opportunity neighborhoods, also known as our Celebrate One neighborhoods. Today, we vaccinated almost 150 people at the health department coming from those zip codes that we know are very vulnerable neighborhoods, still meeting the criteria of being over 65 and having one of those medical conditions. But I think it was a welcome to the residents to be able to just come into the health department, get your vaccine, and be able to, whether it's hop on the bus or have someone drop you off there. But for some people, it was much more convenient than going through our drive-through clinic at the fairgrounds. We're also doing some mobile teams, and we're picking our locations based on the CDC Social Vulnerability Index, which is basically you put in an address into the CDC's website, and based on the income, the race, and the medical conditions and transportation of that neighborhood, they give you a score anywhere between 0 and 1. We really try to prioritize those neighborhoods and those addresses that are at 0.75 or higher, which we know are very vulnerable communities. We've also, in terms of removing barriers, in addition to the mobile team, we know that not everyone has access to the internet or has a smartphone or ability to sign on online. So we also have a phone where people can register. There is a phone number, so we're not just limiting to those to register online. And then we're informing and engaging the community. I do a lot of talks like I'm doing tonight with you all for the town hall, reaching out to barbers and beauticians, reaching out to the Divine Nine in terms of all the fraternities and sororities, reaching out to neighborhood groups and partners, providing some basic education, really to just get factual information in the hands of our community so they can make the right decision for themselves and their families. And we're partnering with the Department of Neighborhoods to really help us engage more community partners and get some boots on the ground. And the City of Columbus, as well as Franklin County and our hospital partners, are launching a community multimedia campaign with a special focus on the underserved minorities as well. So we're doing a lot. I still think there's more we could do, but we're doing a lot to increase the diversity and access of this vaccine to our most vulnerable in our community. So if you want information about the vaccine, how to get the vaccine, how the vaccines are distributed, where the vaccine is, more about who should get the vaccine, how the vaccine works, here are some reputable resources that I want you to look at and use. You can obviously go to our website. If you have questions, you can give us a call at our number there, 614-645-1519. You can also go to Ohio Department of Health's website at vaccine.coronavirus.ohio.gov. I would also encourage you to check out the CDC's website. They have some robust information now, and it is science-based, and I encourage you to take a look at their website, cdc.gov/coronavirus/COVID-19. And we just launched a new program yesterday that I'm super excited about, where we can text you updated information if you want to know when we're opening up the lines for vaccine for the following week, or anything that we might be pushing out to the community. So you can text the message VAX-CBUS to 888-777. Again, the message should be VAX-CBUS and the phone number should be 888-777. And so that will be information for Columbus and Worthington. And then once you get registered, and the registration is just texting that message to that number, we'll reply, and then we'll ask you for your zip code. And if you're willing to share your zip code, we can also send you targeted information about vaccine clinics that might be available in your zip code area or in your neighborhood. So it's a new tool. I promise you're not going to get tons of texts from us that'll keep you up at night or anything like that, but I do encourage you to take advantage of that. And you can always opt out if you get tired of it and you don't like it. You can always stop and opt out of it. So I'm happy to answer any questions that you have, Chair Tyson or Council President Hardin. Happy to answer questions, and I encourage you to also follow us on some of our social media platforms where we push out a lot of helpful and timely information about COVID-19 and this pandemic. So thanks again for having me.
Thank you, Dr. Roberts, for the presentation. That was extremely helpful and informative, and you answered so many of our questions. I think I turn it over to Councilmember Tyson for a quick PSA.
So the PSA, as COVID-19 made it difficult for you to keep up with your bills, Columbus is offering one-time grants to Columbus residents to help fill the gap. For more information, visit www.columbus.gov Pay Assist or call 614-645-8276. 614-645-8276. Families who are unable to pay their utility bills because of issues related to COVID to the coronavirus pandemic should apply. And again, 614-645-8276. The Public Utilities CARES Act Assistance Program offers one-time payment up to $750 for an eligible Columbus water, sewer, or stormwater bill, and up to $500 toward an eligible power bill. To see if you qualify, again, call 614-645-8276. Let us help you fill the gap. And President Hardin, I think we want to take, again, I want to say thank you to Dr. Roberts and just appreciate your thoroughness of your presentation, but also very excited about your vaccine equity plan. So thank you for sharing that this evening. It's pretty impressive. And I also want to thank you for the new social media posts that are out with many of the Black physicians that are sharing why it is important to take the vaccine. So thank you. And Council President Hardin, I think we have questions we would like to ask Dr. Roberts from the community.
Yes. So as we transition into questions from the community, I too join Chair Tyson in thanking Dr. Roberts. This has been a long 10, 11 months for almost 12 months for you, or more than 12 months if you think back to when you started tracking this virus. So just thank you and your team. COVID-19 has ripped through our city over the past year, but we are here today because we know folks still have questions and deserve answers. Hesitancy comes as no surprise. It's going to take more than numbers and data. It's going to take folks seeing those that they trust step up and take the vaccine, but also from hearing from experts like Dr. Roberts. With that, Councilmember Tyson and I have some questions below. Councilor Tyson, do you want to just go every other one? I think we're seeing the same questions. If you want to take the first question, and I'll take the one right after that one.
Okay. All right, the first question is, why is it so difficult for residents to schedule second shots? Many providers schedule the second shot no later. Many providers schedule the second shot no later than the time the first shot is given. Columbus Public Health has provided contradictory information about when second shots may be scheduled, and it appears that they cannot be scheduled until the day before they are due to be given, although it is unclear that may even be scheduled then. For my wife, this inability to schedule a second shot has produced great stress. Is that a sound public health administration? Why is Columbus Public Health scheduling second shots in all of Franklin County? What does Columbus City Council propose to do about being the worst provider of COVID-19 vaccinations? Are the different variants of COVID-19 in Columbus? And if so, how can we keep our family members safe? Will the vaccine protect folks from the UK and South African variants of the vaccine? So Dr. Roberts, there's a lot of questions here from this one member. So I think that the first is about getting the second shot, and it is then
yep. And then the second is about the variants. So I can answer both of those. And so I do apologize that it has been a little cumbersome to get the second dose appointment scheduled. The way we have our electronic health records set up was the system should have automatically sent you a message the day before you're due. So if you got the Pfizer vaccine, you're due on 21 days, and you get the message on day 20 saying when you're due to come back. Oh, sorry, you get the message on day 20 with a link so that you could go online and make an appointment to get your second dose. And if you got the Moderna, you'd get the message on day 27. We've realized that is not working for a lot of people, and that's not the ideal system to have. So starting Monday, when you get vaccinated at Columbus Public Health, when you get your first dose, you will get your appointment for your second dose. When we set up that plan, it was nothing intentional to hold the second dose back or to make it more difficult. We anticipated our system would work smoothly. We learned through this process that AT&T was blocking some of our text messages that were going to our patients because they thought it was spam. So again, we're fixing that problem. And starting Monday, when you're vaccinated at the fairgrounds, you will get your return appointment for your second dose right then and there. We will tell you when you're expected to come back and what time. If for some reason that date and time does not work for you, you will have the ability to call and make a date and time that does work for you. But keep in mind, we cannot give you your second dose before the 21 days or before the 28 days if you have Moderna. And we do not offer our vaccine clinic on Sundays at this time. So, there's a possibility that your 21 day could fall on a Sunday, and we wouldn't be open, but we are open 6 days a week. So that was a learning phase for us, and we have learned and we are adjusting to make it easier for our patients. So I do apologize for the inconvenience that it caused you and your family. As far as the variants go, we have the Ohio State University has identified someone with the United Kingdom variant here in our community. We anticipate that it is in our community. It's probably across the whole nation. It's only been identified in, I think, 42 states out of all 50 states, but we believe that it's everywhere. And we probably have the other variants as well, the South African variant and others. So that's why it's so important that we continue to follow all the public health measures. Although our numbers are looking really good right now, the scientists tell us that in March, the UK variant could be the predominant variant, and we know it's highly transmissible. So it's very important that we continue to follow all of the public health measures, that we get vaccinated when it's our turn. And even once you get vaccinated, you continue to follow all the public health measures. The preliminary data that we have from the manufacturers of the Moderna and the Pfizer vaccine tell us that both those vaccines are effective against the UK variant. We don't know how effective. We don't know if it's 94% effective or if it's 50% effective, but we know that it is effective. So that is good news, and we're getting new data every day about the variants against the current vaccines we have on the market, as well as the Johnson & Johnson one that is not on the market yet because it has not received emergency use authorization yet. So I hope that answered that individual's question.
Thank you, Dr. Roberts. President Harden?
Yes, ma'am. Your questioner asked so many questions. You got so many questions answered in that one question. I really only have one more in the list of questions that I got from folks who responded to us with questions tonight, and it's around. This must be a city employee. So the question is: will city employees be forced to take the vaccine? If so, will an employee lose their job if they do not comply? And I would just say, Dr. Roberts, if you could broaden that question or that answer.
Yeah. Sure.
Around policy.
So I don't believe that employers are going to mandate the vaccine. And if they do, that's something they should, discuss with their legal counsel. By no means is any public health agency mandating that or suggesting that the vaccine be mandated for any one sector of our community. If you think about it, think about vaccines that have been around for so many years, like the flu vaccine. Only our healthcare agencies really mandate that. And even when they mandate, there's always an out clause. So if you have a medical condition or religious reasons, you can exempt from getting that mandated vaccine. Even in our schools, there are vaccines that are expected and required for kids to matriculate in school, but parents have an option to opt out of that if they choose to. So I do not anticipate employers mandating this vaccine. There are some employers who are incentivizing their employees to get the vaccine by giving them financial contributions if they get vaccinated. But I do not think this is a vaccine at this point in time that should be mandated.
President Harden?
Thank you. Councilman, do you have, I will turn it back over to you for maybe one more question, and I did find one more question after that, if you have any. Now I can go take a shot at one more question.
No, President Harden, you can go ahead and take the second. There's another question that's here, so you can go ahead and ask that question.
Okay. This question is regarding New Americans and outreach with language. How are we making outreach to our New American population?
Yeah, so we are doing our best. We are working with a lot of community agencies and resettlement agencies to get the information to them, to translate the materials we have. And we are planning, especially when we can open up the vaccine to more in that community, to do some targeted outreach for vaccine clinics to our New American communities with translators from their community that they know and trust, and likely at locations in their community that they know and trust. So we continue to work with them, provide them educational information, and we will be getting to them shortly with vaccine clinics.
President Harden, I think we have another question, and I think Dr. Roberts, it was really regarding, and I just want to make sure I ask the question since someone's done in, but really it's about a centralized website where they can find the vaccine. And this person is saying, I visit the Board of Health website. It looks like I have to try to schedule an appointment at dozens of options. There was CVS, OSU, etc. Do I have to go to each website to see if they're available? This is very difficult for the older population. It's difficult to navigate for even the most tech savvy, because the website is a little wonky to work with. And so again, I think you've already kind of shared it, but I didn't want to, since this question came to us, I just wanted to make sure we asked it.
Yeah, sure. I share this individual's frustration, and I have shared it with the state as well. It's great that they have multiple providers in Franklin County who have the vaccine, but in Franklin County, we get on average 10 to 15,000 doses of the vaccine every week for first doses. And if those doses are spread out among 25, 30 providers, that makes the work for the patient harder. They've got to find one of 30 providers that has the vaccine for them. And that's hard work. I don't care how old you are, that's hard work. So we've asked the state, I get you want to spread it out, you want to make it neighborhood based, and you want people to have options, but by doing that, you've also created work for the patient now, because they've got to, in essence, find a provider who's got available vaccine for them, versus if you only had the vaccine available at 3 or 4 places, then people would only have 3 or 4 places to look versus 25 or 30 places to look. There is no website right now that will tell you this site has available vaccine, call now or go on the website now. There is no centralized location. I think the state is working on it. They're purchasing some software that will hopefully help with that. It's not clear to me how long it will take for that to be up and operational. And it's also not clear to me how many of the providers are going to participate in that, so that the information there is accurate and usable. So I share your frustration. I wish I had an easy answer for you. If you do have a medical provider through one of our adult hospital systems, they are notifying their patients who qualify. That might be the easiest, fastest route. Columbus Public Health opens up our registration every Friday morning. So if tomorrow's Friday, if you're eligible, you can call us at 645-1519. And if you're tech savvy at all, you can use that VaccBus to 888-777, and then we will push out notices when we're opening up our vaccine clinics, so that you'll have a heads up.
Thank you, Dr. Roberts.
Councilmember Tyson, if you don't mind, if I ask one final question, and then we'll close out.
Yes.
This question, Dr. Roberts, is kind of specific. It's regarding a person who sounds like they have already scheduled their second appointment, but potentially have a scheduling conflict. Is there a number to call? Is there a way to call back in, or to check on if you need to change schedule conflict?
If they have an appointment with Columbus Public Health and they need to reschedule it, they should call us at 614-645-1519. Go through, listen to all the messages, and wait till you can get to an operator or a person. Talk to the person and let them know your circumstances, that you need to change your appointment, and we'd be happy to accommodate you.
You are awesome. Thank you so much. Really excited about the change too, regarding signing up for the second appointment. That was something that we just heard anecdotally out in the community. So I think that is a good change to hear. Councilmember Tyson, I see one more PSA. Do we want to do that, and then we can close out?
Okay, that's fine. Yes. Whether it's due to past negative experiences with the healthcare system, doubt about the COVID-19 vaccines, or lack of access to care, African American Ohioans need access to accurate, reliable information about the vaccines, as we've even heard tonight. The truth is that COVID-19 vaccines are safe, effective, and rigorously tested. For more information, visit columbus.gov/coronavirus. Thank you.
Thank you, Dr. Tolliver, and thank you to Dr. Roberts and Dr. Tolliver for joining us this evening and providing so much information to this council, but more so to this community. Getting everyone vaccinated, and on the other side will take all of us working together. We all have our own stories, and also heard stories about how COVID-19 has impacted our family and friends. What we've heard today will need to be shared with folks we know to dispel the myths out there, so we can encourage folks to get vaccinated. Now I'd like to turn things over to Councilmember Tyson for closing remarks.
Tolliver, as Dr. Roberts, Dr. Tolliver, and Edward Johnson. I'd like to thank everyone for being here today and participating in this Get Ready Columbus, the vaccine is here, COVID-19 town hall. As Americans, we have traditions that define us. First and foremost, we love being around each other. So this is why it is important to encourage everyone to do the research and make a choice as wise and reflects the best decision for you and your family in terms of taking this vaccine. We have to end this pandemic to get back to being normal again. In the interim, make sure you continue to wash your hands, wear your mask, and practice social distancing. And again, we're all in this together in Columbus, And I also want to mention that Monday, February 22nd, we'll also have our regular council meeting at 5 o'clock. Thank you for listening. And remember, we are all in this together. Thank you.
Thank you, Councilmember Tyson. I just want to give Councilmember Raymond, do you have any closing remarks?
Just thank you to both of you for hosting the hearing this evening. It's obviously been a very valuable piece of resource to listen to and hear the comments, and certainly appreciate Dr. Roberts and Dr. Tolliver's input. I know it's challenging, and certainly glad that Dr. Roberts pointed out some of the issues we have with the state. If things were under our control, there might be a little bit more better outcomes, but certainly hope that everybody can navigate it positively and ultimately find the vaccine. So as more of these vaccines come online, we're certain that it'll make it more readily available and easily available to every citizen as their time approaches. So again, thank you for the hard work, and thank you for the opportunity for the hearing.
Thank you so much. Again, thank you to my co-chair, Chair Tyson, and all the folks who participated. And with that, we will end this evening's town hall.
Thank you.